Hello and welcome to Kin 339, Sports Psych Behavior and Performance. This module is all about high versus low achievers. Now, what we really want to be able to work on in this module is to understand and differentiate between high and low achievement behaviors. Okay, so things that we'll be looking into are related to achievement motivation theories, goal types and orientations, along with coping skills. Okay, there are four achievement motivation theories as we've learned in this course. There is the need achievement theory, attribution theory, achievement goal, and the competence motivation theory. Now, each one of these theories have their own components that we want to take a quick review of. Okay, remember, in the need achievement theory, we're primarily looking at motivation to achieve success versus motivation to avoid failure. Understanding that there's personality, situational, resultant, emotional, and achievement behavior factors that go into this. Ones we want to really tie into with motivation to achieve success is that our emotional reaction is really to focus on the pride of success, whereas if we're motivated to avoid failure, it's the focus on shame of that failure. While those that are motivated to achieve success seek out achievement situations and look for challenges, and their performance is actually enhanced in evaluative situations, the opposite is typically true for those that are looking to avoid failure or avoid the shame that comes with failure. So understanding that somebody who looks to avoid shame would look to avoid competition that is a 50-50 toss-up, right? They want a sure win, or if they're in a competition and it's the competitors are way better, they're actually okay with that because there's no shame in losing to somebody that's better than you. The shame comes when you have a 50-50 kind of competition and you lose to that person. That's typically when there's a lot more shame. So, just the idea, understand that in this theory, the factors and the primary emotional reactions that we're looking to achieve along with the achievement behavior. Okay, with the attribution theory, remember that the attribution theory is the theory of how we attribute or what we attribute to our successes and failures. All right, so understand the levels and the categories here. So the basic attribution categories are stability, locus of causality, locus of control. All right, within stability, there's those factors that are stable and unstable. Along with locus of causality, there are internal and external causes of your success or failure. And then the locus of control is was the success in your control or out of your control, or same with the failure, in your control or out of your control. And how we use these attributions really matter, right? Because when we look at table 4.1, attributions and achievement motivations, there's a psychological component to our attributions. So I want you to take a look at the expectancy of success. That is related to our stability factors, right? So take a look. If you attribute things to stable factors, you're actually increasing the expectation of success in the future. Where if you attribute things to unstable factors, they actually decrease your expectation of success, right? Again, taking a look at the causality factors and emotional influences, here we're looking at the increased or decreased pride and shame based on internal or external attributions of that success or failure, right? And then lastly, we have the control factors, if it's in your control or out of your control, and these have an emotional and psychological resultant of increasing or decreasing motivation. We'll see this play out in a different slide here, but again, understand the correlation between the attribution, stability, causality, and control factors versus their psychological result, right? Expectancy of future success, emotional influences for both causality and control. So again, take a look at this, pause it, memorize how these things play together, and then we will use it later in this module. Okay, goal types and orientations. Remember, You should have a firm understanding and being able to define what an outcome goal is, performance goal, and process goal, along with our orientations, right? Task mastery is where an individual is more concerned and focused on mastering a task, worrying about the process to improvement, whereas outcome or egocentric orientations tend to really put a lot of pressure on themselves for outcomes, and they tie their pride and or shame into those outcomes. Whereas again, research indicates that task mastery, goal setting is much better than outcome goal setting. So taking a look at your goals and making sure that you put most of your emphasis on performance and process goals, although outcomes are very important, they're not and should not be the driving factor. Okay, within the achievement goal theory, there are three components: the achievement goals, your orientation, and your perceived ability. Those two added together will give you your achievement behavior. So you can mix and match these. For instance, outcome goal oriented or outcome oriented goals with high perceived ability or competence tend to lead to success. However, if you're outcome goal oriented and have low perceived ability or competence, that can lead you to learned helplessness because you are so worried about outcomes, you're not concerning yourselves and focusing in on the process to improve something, and therefore you get discouraged when you don't see the goals or the outcomes in your favor, right? And when you have low perceived ability, that also throws in a wrench into your psychological makeup because now you don't believe you can do it, and therefore causes a lot of stress and anxiety. Better to be task oriented in everything you do, whether if you have high perceived ability or low perceived ability, because in either case, you're more concerned with the process and performance goals rather than outcome goals. Now, again, all those two, achievement goal orientation and your perceived ability, will determine your behavior. It determines your performance, your effort, how you're going to be resilient through challenges, and it will even affect your choice of tasks, right? Whether you choose realistic tasks and opponents or unrealistic tasks and opponents. Competence motivation theory really drives from the inner part of us that wants to feel as though we're good at what we do, right? So it's the desire to feel self-worth. Now, it's important that we develop intrinsic motivation in children. That's the ABCs, right? Autonomy, belonging, and competence. This drives their psychological makeup for themselves for the rest of their lives often. It's difficult to change our perception of ourselves if in the early stages of psychological development, that brain and our mindset is that we can't do it, or we're not good enough, not tall enough, smart enough, strong enough, fast enough, whatever that is. So developing that ABCs of intrinsic motivation is critical. Our feedback and reinforcement that develops or destroys self-esteem is really critical. Some of you may have experienced this with coaches in the past that either built you up and made you feel really good about yourself, and hey, you're learning, even though you're making mistakes, you're learning and you're growing, or maybe coaches made you feel really bad about yourself. And so you actually maybe even dropped out of the sport, or you developed a bad image of yourself because of a coach or a parent or a teacher, right? So it's really important that the feedback and reinforcement we deliver is one that will help build self-esteem. And then again, this all relates to our self-determination theory. Okay, remember with intrinsic motivation, we want to ask ourselves the three questions: can I do it? Self-efficacy, will it work? That is our response efficacy. And is it worth it? Are the consequences worth it? That's the motivation question. And those tie into our self-determined behavior of autonomy, belonging, and competence. And as you recall, autonomy is equated to choice. Belonging is the community we are surrounded by that can either build us up or tear us down. So make sure your community is building you up. And then competence is self-efficacy, and the best way to develop self-efficacy is to set goals and achieve those goals. Little by little, improving our skills, both physical and mental, to help us believe that one, we can learn, and two, that we are capable of persevering through challenges to accomplish our goals. Okay, so there's lots of factors affecting our motivation and arousal. Again, remember, it's super complex. This is just a simplified list of things that affect our motivation and arousal, right? Our personality, what surrounds us, the complexity of what we're doing, our own perceived ability and our perception of control, along with social support, and then our own toolkit. Our own toolkit can either benefit us or it can really hinder us from achieving what we want to achieve. So making sure that you develop good coping skills and have a bunch of tools in your toolkit that you can pull out when necessary to achieve what you need to achieve, and regulate the emotions and arousal that need to be regulated in the moment of highest stress and anxiety. All right, now table 4.2, I'm going to let you pause this for a moment, but I really want you to pay attention to what the high achiever versus low achiever behavior look like for their motivational orientation, attributions, goals adopted, their perceived competence and control, their task choice, and their performance conditions. So again, take a minute and pause, and these correlations to the high and low achiever behavior will be something you will be tested on. And please, by all means, send me an email if you don't quite understand what it's getting at, because I understand that this can be a little bit complex, but if I try to describe it more than what is written here, I think sometimes that gets more confusing. So just think about, each of these categories and how a high and low achiever differ when within their behavior. Okay, so again, as mentioned, developing coping skills is incredibly important. Mindfulness, goal setting, visualization, arousal regulation, self-talk, routines, resting and recharging, right? All of these are critical. You've been given strategies throughout this semester on how to, well, first off, we've educated you on them. We've given you strategies to acquire these skills. Now it's up to you to go practice them. Just like you would practice physical training, you need to practice your mental training. Put them into use and see that they will benefit you time and time again, because again, life is a continuation of one event after the next, and we continue to feel like we're in a performance all the time. And the more we have in our toolkits, the better we will behave and perform. And now, so the last thing we want to leave you with is some critical thinking here. How do these individuals differ when you're high versus low achievers in their behavior? So think about the 4 motivation theories. How do they differ in each of those? What types of goals and how do they differ in their goal setting ability, and what types of goals they choose? Also in the performance and evaluative situations, the difference in task and competition choices, along with their coping mechanisms. How do they differ in all those areas? Again, you'll review these in your questions for Module 8. So take a look at those questions, think deeply on those, and make sure you're preparing yourselves for the midterm that is coming up. These will all show up there. So if you have any questions, comments, thoughts, concerns, please let me know, and I'll be sure to help you out the best I can. So keep doing what you're doing. You're doing awesome. Together, we are champs. Go Beach!